series on complex primary total hip arthroplasty following post-acetabular fracture sequelae with and without infection using 3D technology. The rise in the number of road traffic accident and the complex trauma is alarming, and complex primary THR in post-acetabular fracture is a well-known sequelae and a well-known treatment. It's complex because of the distorted anatomical landmarks and increased overtime and the cost of the burden on the patient in the hospital. So our primary aim was to assess whether the usage of 3D printing technology and pre-planning reduces the overtime cost and reduces the complication rate. The retrospective study included 9 cases done between October 2015 to 17 with minimum 3-year follow-up period. They were divided into 2 groups, Group A with the signs of infection, increased ES without signs of infection, and Group B with positive signs of infection, either clinical and increased elevated parameters, ESR, CRP, and D-dimer. Case distribution, Group A included 5 post-acetabular fracture fixation with no signs of infection, Group B 3 post-acetabular fracture fixation with signs of infection, and 1 neglected acetabular fracture following an infected DHS fixation removal. And 3D printing, 3D model prototype pre-planning was done for almost all the cases, and the Acetabular 3D printer was the one which we had in-house, and ABS material was used to make the 3D models. Once the radiological investigation is done from the bone and soft tissue, the DICOM images collected from the CT and MRI. We use the Mimix 3D modeling software and Cura, the 3D slicing software, and we have a 3D printer of Acetabular. We made sure the CT scan of 0.6 done was included. This is one example in a 34-year-old male following a road traffic accident in 2014 January. After 18 months, he came with a painful hip and a wheelchair bound. In X-ray, it was looking haphazard and very complex, and the 3D model prototype pre-planning was done. Intraoperatively, we had the similar picture of intact anterior ollum and the column, and the posterior ollum and the column was deficient between 10 o'clock and 5 o'clock, and we used the femoral head in place of the augment, and the same size of the cup Sister 60M shell was used with the reduced in number of OT time and the blood transfusion rate. Another one example of a 30-year-old male following a road traffic accident in 1999. He had a painful hip gait with a colostomy bag on and a non-healing ulcer in his buttock. And most of the surgeons denied the total hip replacement for him. And after 17 years, he came to us and we did the 3D model. And this 3D model, once we have in the model, it looks so easy. It gave an idea of what is going to be the size of the cup, and also the short offset, horizontal offset ASTROM was planned and was executed intraoperatively. Another one example where the patient was wheelchair bound because of the polytrauma. One side he had a shaft of femur fracture with a nailing gun, other side I had a central dislocation, and with 3D printer model was done and a jumbo cup concept was used. Another one example where the femoral head was used as an augment and it was executed in the same way as we planned. Another one example where this had a doubt whether it was union or non-union, and the 3D printer also gave us an idea that it was completely united, and it gave us the size of the perfect size of the cup and also the screws in which the direction where the good bone stock, and we executed the same thing. Here one case where the post-acetabular fracture fixation with the signs of infection. Clinically, there was no sinus or anything, but the increased ESR CRP parameter bleed. So the stage 1, we removed all the implants and antibiotic-loaded cement spacer with the gentamicin, and the gentamicin and vancomycin was kept, and a 3D model was done, product was done, and the same was executed as we pre-planned. One more case with the pre-planned DHS was done, and augment was used in place of to fill the posterior defect. 2 more cases we did the prototype, but because of the excessive infection and persisting infection, excision arthroplasty was chosen. Male patients, the mean age was 39.5 and expected